My name is Leonel Estofan. I'm a doctor in neurology who specializes in epilepsy. The people used to know like seizures. What inspired me in epilepsy is my early exposure to epilepsy patients and the big change that I see with my mentors in residency and fellowship. I love to help the patient with epilepsy.
My name is Torres-Reveron. I am an epilepsy surgeon by training, so I'm a neurosurgeon that has a specialty in epilepsy training. I have a PhD in neurophysiology. So when it came to looking for a clinical area, it actually was a pretty easy fit. Obviously, since epilepsy is a problem of the physiology of the brain, I became very excited about the therapy. So that's how I ended up as a neurosurgeon doing epilepsy care.
At DHR, there were not many specialists in epilepsy, so we didn't have a well-organized system. We acquired the technology to help the patients. We create an epilepsy center with epilepsy monitoring units so that help us to really diagnose and understand what's going on with the patient. And having a neurosurgeon specialized in epilepsy is like a dream for us. There are a few in the country. So be able to do stereo CEGs, so complex cases, see that there is a change after the surgery is really rewarding.
Whenever I speak with epilepsy patients, I think the one thing I find is that many of them have gotten used to I only have a couple of seizures a month. And I've had to effectively train people into learning, no. One seizure is one seizure too many. Every event is affecting how you think, how your memory works, how you can calculate whether or not you can perform your job. So it is essential to try to stop it as early as possible. Community is big. And in fact, there's a reason why I'm down here. So coming down here was not just for bringing epilepsy care to a border town of Texas. It was more of, I'm bringing epilepsy care to my people, bringing epilepsy care to Hispanics in the community, people that otherwise, in many cases, they feel marginalized because they don't want to go to big centers or big cities.
I love this community. This community is Hispanic and make me feel like at home, and originally from Argentina. Being able to help people is linked to us, to our culture, and see that not many doctors want to work in areas away from big cities or centers. So these people sometimes need to travel or need to go to a big centers where they don't have the resource to go, or they don't have the transportation, so they don't have the help that they need. And see that you can make an impact in the community like that, and helping the community and being part of the community is like unbelievable.
If you have tried medication, you have tried 2 medications and you have failed, it's time to think about the next step. Don't wait. I don't care if you're 10, if you're 20, if you're 30. It's not a condition that will necessarily go away with medication if you have failed. It's time to take the next step. Don't be afraid. There's a lot of options out there, and many of them are great.
There are so many resources right now. We have medication, we have surgery options, we have artificial intelligence devices. The patient can change the quality of life, they can have a normal life again, and they can enjoy the family, and they don't feel like they become a burden for the family. Always keep looking for help, and epilepsy most of the time we have tools to help.